Hello from Andreas Holistic Coach Virtual Secretary. Today, we talk about nutrition and epilepsy. Immediately after the theme song. Epilepsy is a neurological disorder marked by unpredictable seizures. It is one of the most common neurological disorders, affecting about 50 million people worldwide. The exact cause of epilepsy is unknown, but science thinks a combination of genetic and environmental factors causes it. There is no cure at the moment, but there are treatments that can help to control seizures. These treatments include medication, surgery, and lifestyle changes. One of the most important lifestyle changes that people with epilepsy can make is to eat a healthy diet. A healthy diet can help to improve overall health and well-being, and it may also help to reduce the risk of seizures. Several nutrients are essential for people with epilepsy. These nutrients include protein. Protein is essential for the growth and repair of tissues, including brain tissue. Adequate protein intake is necessary for people with epilepsy, as they may have increased protein needs due to seizures. Carbohydrates. Carbohydrates are the body's primary source of energy. People with epilepsy should choose complex carbohydrates, such as whole grains, fruits, and vegetables, over simple carbohydrates, such as sugar. Fats. Fats are essential for absorbing vitamins and minerals and play a role in brain function. People with epilepsy should choose healthy fats like olive oil, nuts, and avocados. Vitamins and minerals. Vitamins and minerals are essential for overall health and well-being. People with epilepsy should make sure to get enough of the following vitamins and minerals. Vitamin B6. Vitamin B6 is involved in metabolizing proteins and carbohydrates. It is also essential to produce neurotransmitters, which are chemicals that allow nerve cells to communicate with each other. Vitamin B12. Vitamin B12 is involved in producing red blood cells and the metabolism of proteins and carbohydrates. It is also essential for the function of the nervous system. Magnesium. Magnesium is involved in the function of the nervous system and muscles. It is also essential for the metabolism of carbohydrates and proteins. Calcium. Calcium is essential for the health of bones and teeth and for the function of the nervous system. Phosphorus. Phosphorus is essential for the health of bones and teeth. It is also crucial for metabolizing carbohydrates, proteins, and fats. In addition to eating a healthy diet, people with epilepsy should also ensure they get enough sleep and exercise. Sleep deprivation can increase the risk of seizures, and exercise can help improve overall health and well-being. And do not forget water. A disruption of the electrical activity in the brain causes epilepsy seizures. There is some evidence to suggest that dehydration may trigger seizures in people with epilepsy. This is because dehydration can lead to a decrease in the amount of blood flow to the brain, which can, in turn, trigger seizures. If you have epilepsy, it is essential to stay hydrated. Drink plenty of fluids, especially water, throughout the day. Drink even more liquids if you are sweating a lot, such as during exercise or hot weather. Here are some additional details about the link between water deprivation and epilepsy. Dehydration can cause several changes in the body, including blood pressure, heart rate, and body temperature. These changes can trigger seizures in people with epilepsy. Dehydration can also decrease blood flow to the brain. This is because dehydration can cause the blood vessels to constrict. When the blood vessels constrict, less blood can flow to the brain, leading to a lack of oxygen, which can trigger seizures. Dehydration can also decrease the amount of cerebrospinal fluid in the brain. Cerebrospinal fluid is a clear fluid that surrounds the brain and spinal cord and helps to protect it from injury. Dehydration can cause the level of cerebrospinal fluid to drop, which can put pressure on the brain and trigger seizures. If you have epilepsy, it is essential to stay hydrated. Drink plenty of fluids, especially water, throughout the day. Drink even more liquids if you are sweating a lot, such as during exercise or hot weather. If you have any questions about dehydration or epilepsy, be sure to talk to your doctor.